want to talk about a common topic which a lot of people ask about is rhinoplasty. So what is rhinoplasty? Rhino is basically the Latin term for nose, and plasty means to modify. So modification of the nose is the rhinoplasty. So what does rhinoplasty involve? So rhinoplasty basically involves rearranging the framework of the nose. So as we all know, if you have, most of us have touched our noses, so we know there is a bony part at the top and then there is a soft cartilaginous part. In between there is a septum which divides the left and the right nostrils. So when we are trying to correct the nose, most of the times what we are trying to do is rearrange the framework. So rearrange the bones, rearrange the cartilages, rearrange the things under the skin so that the skin can fall over it and give you a better shape. Because as we all know, even though we do with meticulous care, whenever there is a cut on the skin heals with a scar. So you're not doing too many things on the outside to damage the skin, which might leave scars. So that is why rhinoplasty basically involves rearranging the framework inside. It is the bones, cartilage, skin, soft tissue, fat, whatever is there, to try and modify the framework inside and allow the skin to drape over it. What are the different kinds of rhinoplasty? Broadly divided, the rhinoplasty can be divided into an aesthetic rhinoplasty and a functional rhinoplasty. Though there is a broad division between the two, most of the times there is a combination of both aspects when you do a rhinoplasty. You can't do an aesthetic rhinoplasty purely aesthetic. There might be some functional aspect to it that you need to correct. Similarly, so when you're doing a functional rhinoplasty, we always try and keep the aesthetics in the mind, even when we are doing a functional rhinoplasty. Aesthetic rhinoplasty per se by definition only deals with your aesthetics or your modification of the nose to give you a better look. So it only deals on the aesthetics part of it. So like if there is a hump or there is a broad nose or there is a deviation which is not looking good, so that is what is dealt with when you're doing aesthetic rhinoplasty. Functional rhinoplasty has other components which deals with your breathing and with your like if it's a deviated septum, you have functional issues which are causing breathing issues. So then that you're treating that, you have functional rhinoplasty. You have a drooping tip, you have a collapse which is again causing breathing problems, that is a functional rhinoplasty. So many a times there is an overlap and we do both of them together, but purely by definition a functional rhinoplasty is something which deals with the function of the nose, that is mainly breathing and correcting problems related to that. And aesthetics is the look of the nose and you're trying to correct things which are going to make the nose look better or balanced with your face. So what are the different kinds of rhinoplasty? Broadly speaking, the rhinoplasty again from the surgical point of view is divided into an open and a closed rhinoplasty. In an open rhinoplasty, you give a cut underneath the nose and then we lift the skin up and we rearrange the framework. In a closed rhinoplasty, there is no outside incision which is seen. Most of the surgery is done from inside the nostrils, and there is a lot more technique involved because you have to do it blind and you go more by feel. The open rhinoplasty is reserved for places or patients who need a lot of tip work. Then because you have to rearrange the tip or you have to arrange a drooping tip or cleft noses. So when there is a lot of different work that is involved, then yes, we have to do an open tip rhinoplasty. There is no way to avoid it. But yes, if it is only at the dorsum or the reduction which needs to be done, then we do a lot of closed rhinoplasties as well. Advantage or disadvantage between it is an advantage of an open rhinoplasty is everything is visible, so you can see actually what you're doing and then you close the incisions, but the healing time is a little more. The swelling of the tip takes a little longer time, and of course though the scar is very minimal, there is a scar. In a closed rhinoplasty it is more technique dependent and it needs a lot of skill, but of course it helps because the swelling is less and the recovery is much faster. So what is the healing period like? Rhinoplasty typically is a very well tolerated procedure because it's only an isolated area of the face. It's like you having a cold. If it's only a tip correction or something which is minor, then yes, you might have a plaster for about 3 to 4 days. But if it's a major reconstruction or a full rhinoplasty that we're doing, then yes, you will have a plaster on your nose for about a week. You might have some under eye bruising, especially when you're doing osteotomy or breaking of the bones. So there is under eye bruising which takes about a week or 10 days, and then the plaster is removed after a week. After that, it's just basically you have to allow the swelling to settle down. Complete healing for a rhinoplasty takes 3 months. That is normal for any surgery that we do, but the visible swelling changes might go away in maybe about 2 to 3 weeks, but full result for your nose to feel soft, for it to feel normal, for it to feel functionally normal and without any numbness, all that takes about 3 months. So you have to give yourself that time. Are there too many revisions? Rhinoplasty is one of the few surgeries that you might need some minor revisions later on. This is because when we are breaking a bone or we healing the cartilage, there might be some excess healing, or there might be some excess callus or some minor readjustments which might be required. Not in every case, but yes, in some cases. But those are usually minor and then can be tackled with the local anesthetics and a small corrective procedure once the healing is complete, that is after 6 months. If you have any other queries related to rhinoplasty, or if you think that you need something done to your nose but you're not sure, get in touch with us so that we can help you out, and you can send us some pictures and we can have a look and explain it better as to what is possible.